Why did Arkansas lose so many enrollees under new Medicaid rules? Have you ever wondered why Arkansas saw such a significant drop in Medicaid enrollees recently? The answer lies in the new work requirements that were put into place. These rules required adults without dependent children and parents of older children to document at least 80 hours of work, volunteering, or education each month to keep their Medicaid coverage. This requirement created a lot of challenges for many enrollees. One major issue was the complexity of the administrative process. Many people who were working or eligible for exemptions lost their coverage simply because they did not realize they needed to submit new paperwork. Some missed deadlines, while others found the system too complicated to navigate. This led to a loss of coverage even when they met the work criteria. Interestingly, these work requirements did not lead to an increase in employment among Medicaid recipients. Instead, they mainly resulted in more people becoming uninsured. This did not improve job rates or health outcomes, which raises questions about the effectiveness of such policies. Another significant factor was communication. Studies indicated that many individuals affected by the new rules were unaware of the changes. This lack of information contributed to unintentional disenrollment, meaning people lost their coverage without fully understanding the new requirements. The costs associated with implementing and managing these work requirements were also substantial. For states like Arkansas, the administrative burden often outweighed any perceived benefits. This complexity can strain resources and healthcare providers, especially in rural areas where access to care is already limited. These changes are part of a broader trend of federal Medicaid spending cuts and policy shifts that have reduced Medicaid coverage across the country. Vulnerable populations and rural communities, like those in Arkansas, have been disproportionately affected by these changes. From a healthcare perspective, the rise in uninsured individuals can lead to increased medical debt and reduced access to care. Hospitals, particularly in rural areas, may face more unpaid care and financial strain, which could result in service reductions or even closures. In summary, Arkansas lost many Medicaid enrollees due to the new work requirements that created administrative hurdles. These barriers made it difficult for many to maintain their coverage, rather than reflecting changes in employment status. This situation highlights the ongoing challenges in Medicaid policy and access to health insurance.